Good afternoon, everyone. I'm grateful to be here with the community leaders and partners to speak about an issue that touches lives across every zip code, the proposed federal cuts to Medicaid. At Bergen New Bridge Medical Center, New Jersey's largest hospital and a vital safety net facility, we care for everyone. That includes your friends, your family members, your neighbors, especially those who are most vulnerable. Medicaid is not just a line item in a federal budget. It is the foundation of care for millions of Americans. 1 in 10 veterans depend on Medicaid. Nearly 1 million children in New Jersey alone rely on Medicaid for their health and development. 1 in 5 older adults are on Medicare, also depend on Medicaid for their health care. And more than 70 million Americans nationwide, someone each of us knows, count on Medicaid every day. And these aren't just numbers. These are people we see at Bergen New Bridge every single day. And let me introduce you to the faces of Medicaid. A veteran on a ventilator who needs highly skilled 24-hour nursing care. A 5-year-old in the midst of a mental health crisis who requires urgent inpatient treatment. A young father who lost his job and with it his health insurance and is now trying to manage his diabetes without missing a beat for his children. A woman bravely entering recovery after years of struggling with alcohol abuse. A loved one with Alzheimer's who can no longer live independently and relies on long-term care to stay safe and supported. These are the real faces of Medicaid. I know because we see them every day. We care for them every day, and we fight for them every day. If these proposed cuts move forward, the consequences will be severe. Essential services will be reduced. Access to care will decline. More people will turn to emergency departments, an option that is not only more costly, but inefficient and unsustainable for hospitals. Hospitals like Bergen New Bridge are more than healthcare facilities. We are employers. We are community anchors. We are lifelines. When Medicaid is cut, it's not just our patients who suffer, it's our communities. Thank you for standing with us to protect this critical safety net and for recognizing what is truly at stake. And thank you, Congressman Gottheimer, for bringing us all together to discuss the importance of Medicaid. Thank you.
Countless seniors in our communities rely on federal investments to access health care here at Bergen New Bridge and facilities just like this across our state and country. More than 20% of Bergen County residents are 60 and over, the largest population in the entire state. Yet this week we saw extremists in Congress lead and jam through a reckless budget bill through the House that slashes Medicaid, goes after Medicaid, Medicare, and with nearly 14 million seniors and children, including 1.7 million here in Jersey on Medicaid, they will lose their health care if this goes through the Senate, and millions of more families will be forced to pay higher insurance premiums because of it. Here in northern New Jersey, nearly 90,000 people, including 30,000 children and 13,000 seniors, get their health care through programs like NJ Family Care, which would take a serious hit if this bill becomes law.